to the video series Occupational Therapy for the Stroke Survivor at Home. My name is Alyssa. I'm an occupational therapist and certified stroke rehab specialist. If you're a stroke survivor or caregiver, my goal is to provide you with information and advice to help make your lives easier in the home setting. Any information I reference throughout this video series will be made available to you in the video description. Let's get started. As a stroke survivor, you are likely dealing with physical deficits that impact your overall comfort and quality of life. You may be struggling with significant weakness in one arm, increased tone and tightness in one arm, pain, or just difficulty getting comfortable. In previous episodes, we've reviewed different bed mobility and transfer strategies for stroke survivors, particularly with limited function in one arm. For this episode, I want to focus on and provide you with different strategies for positioning the affected arm in bed and when seated. As I have mentioned before, it is imperative that if you are dealing with an affected arm, that you continue to protect this arm during all mobility tasks. It is important yet to continue to protect that arm even when you're lying down for comfort or during relaxation. Stroke survivors often are learning to adapt to either a weak or flaccid arm or the opposite, a tight and toned arm. Both come with their own challenges. However, both require proper positioning to improve comfort, for pain reduction, and for protection. In this episode, I will briefly touch on both increased and decreased tone in an arm post-stroke, the importance of proper positioning of the arm, and demonstrate different techniques for positioning the arm when in bed or in a chair. Remember, not all stroke survivors present the same way and are dealing with the same deficits. There may be different strategies that work for you, and that is okay. Let's get into discussing decreased tone. What do I mean by decreased tone? What this may look like or feel like is one arm after your stroke has become significantly weaker than the other. It's become difficult to use and difficult to manage and maneuver. It may feel like rubber and could even feel very heavy, hard to move around, even when just trying to get comfortable in bed. Oftentimes it may hang by your side when you're standing, or it may have a difficult time hanging on to day-to-day items. This takes place because the damage the stroke has had on the parts of your brain that used to control the arm. Oftentimes stroke survivors who have decreased tone experience what is called a subluxation. Essentially what happens with this, due to the weakness and heaviness of the arm and limited ability to use the arm, it gets kind of pulled from the socket in the shoulder that the arm typically rests in, essentially becoming dislocated. Notice in the picture provided the space between the arm bone and the shoulder joint. That space is referred to the subluxation. This can lead to significant pain in the shoulder that may be felt at rest or with particular movements. If a stroke survivor is experiencing this, know that there are options for treatment, especially with physical and occupational therapy. However, one key factor in the treatment recovery of a subluxed shoulder is proper positioning. With decreased tone, you may be having a difficult time paying attention to the arm, maybe because it feels like it isn't serving a functional purpose, maybe you're unable to feel the arm since the stroke, or maybe because it does not move how you would like it to. These factors can make it difficult to be properly positioned in bed, and if you're not careful, all of these factors can lead to shoulder damage, which could cause further pain and discomfort. Some stroke survivors may be facing very different challenges with their arm. Sometimes following a stroke, one arm can develop increased tone. This might look or feel like increased tightness in the arm. It may be difficult to stretch the arm out and keep it in that stretched out position. Oftentimes the elbow will be bent, the wrist may be bent, or the fingers may be tight and coiled. Additionally, you may notice tightness in the shoulder or chest. This would be described as increased tone or muscle spasticity. This occurs when there is damage to certain parts of the brain from the stroke, causing an increase in tone to certain muscles in the arm. With increased tone, you may also have decreased feeling, awareness, or functional use in the arm. You may also have pain in the shoulder or throughout the arm. Just like with decreased tone, it is just as important to properly position and protect the affected arm when lying down or seated to prevent any further damage. When I talk about proper positioning, I'm referring to different techniques that can be implemented to protect the arm with either increased or decreased tone to improve overall comfort, but also to prevent any anatomical damage. It is important to be mindful of the position of the arm at all times, particularly when lying down and when seated. The basic principle of proper positioning is to consider each joint of the arm and protect each part of it. So, analyze the position of the shoulder, the elbow, wrist, and fingers when considering the position of the affected arm. The most important objective is to protect the arm, so no unnecessary pulling on the arm, be sure not to bend or twist the arm in a way that it is not designed for, and do not crush the arm under the body or between furniture. Depending on the presentation of the stroke survivor's arm, might change the purpose of the positioning. However, for both increased and decreased tone, the basics of positioning apply. Typically, you want the arm positioned in a neutral position, away from the body. Use pillows to prop and hold proper positions as necessary. Recognize that those stroke survivors with increased tone may feel a slight stretch with some of these positions, but as long as pain is not present, it can ultimately improve the function. However, remember to listen to pain. If any position is causing an increase in pain, it is more than likely not ideal and may be causing more harm than good. Let's get into some different positions and break down each one. Remember, for these demonstrations, the person simulating the stroke survivor will be wearing a yellow band on the arm and leg to signify the affected side so that you can better understand and apply these techniques at home. If a stroke survivor wishes to lie flat on their back, there is a way to properly position the arm. Notice here the affected arm is simply placed slightly out to the side and is propped onto a pillow. This positions the arm in a comfortable and protected position. Using the pillow helps to elevate the arm to reduce any swelling, as well as to bring the shoulder joint forward to improve the subluxation. Additionally, if the stroke survivor has increased tone, an additional pillow may be needed to be placed between the arm and body to position the arm slightly away from the body. There may be a slight stretch with that, but it creates a safe, functional position for the arm as long as we're pain-free. Here's how a caregiver can assist a stroke survivor with this position. Notice the caregiver places the pillow slightly between the stroke survivor's body and arm, creating a small distance between the arm and body. The caregiver picks the arm up closer towards the shoulder to avoid tugging or pulling on the arm when placing it on top of the pillow. Oftentimes, it can be more comfortable to lie on one side when in bed. For this position, the stroke survivor is lying on their unaffected side. That side of the body can be positioned, however, is most comfortable. However, for the affected side, you want to provide support to the arm and even the leg and hips. You will notice the placement of a pillow tucked under the affected arm, with the affected arm in a neutral and bent position. If the arm is unable to be placed into this position due to tone or pain, simply placing it in a comfortable position with the pillow's support underneath is acceptable. Notice another pillow between the knees and legs of the stroke survivor. This is mostly for comfort to better align the hips and prevent the knees from rubbing together. Once the stroke survivor has rolled onto their unaffected side, the caregiver gently places the arm onto a pillow in front of the stroke survivor and then places a pillow between the knees and legs. Remember, find comfort, listen to pain, and use as many pillows as necessary. Sometimes stroke survivors think that they cannot lay on their affected side. This isn't true. As long as you can find comfort and ensure you are not laying on or crushing the affected arm, a stroke survivor can lay on the affected side. Notice here there is still a pillow placed between the knees and legs to align the hips and keep the knees from rubbing together. The affected arm is placed out in front of the stroke survivor to reduce the risk of laying on top of the arm and crushing it. How far out it is placed is personal preference. You just want it to be enough to keep yourself from rolling onto it. The unaffected arm is free to be positioned however you choose. Once rolled onto the affected side, the caregiver gently places the affected arm out from underneath the stroke survivor and slightly forward to the stroke survivor's comfort level. The caregiver then places a pillow between the legs for comfort. want to briefly talk about some positioning strategies when seated. Just like when lying in bed, there is a position for the arm when seated that serves to reduce pain, future damage, and to ultimately improve function. With decreased tone, it is imperative to use a pillow or arm trough to support underneath the arm or elbow to keep the arm from hanging or pulling any further on the shoulder joint. By having support under the arm, it keeps the affected arm in a protected position and reduces the pulling that may have been taking place at the shoulder joint that could lead to or worsen a shoulder subluxation, causing pain and reducing function. If a stroke survivor has increased tone, a pillow underneath the arm or elbow to support the arm is still a good idea. The stroke survivor may also benefit from a pillow between the body and the arm near the armpit. This will create a gentle stretch on the arm, which can be good to reduce increased tone and reduce pain. There are many strategies for properly positioning the arm following a stroke. Due to the variety and presentation of stroke survivors, different strategies may be needed for different people. Please be sure to contact a physician or occupational therapist for different positioning strategies if needed. Throughout this episode, we reviewed the importance of proper positioning of an arm following a stroke. This may look different for a stroke survivor who presents with decreased tone versus one who presents with increased tone. However, the same principles apply for positioning either way. We discussed the difference between increased and decreased tone and the effects it has on a stroke survivor as it relates to positioning. Lastly, we reviewed a variety of different techniques for positioning a stroke survivor's arm, both in bed and in a chair. Please reach out to your primary healthcare provider if pain is uncontrollable or with a new onset of pain. Use these strategies to help, and always remember to protect the affected arm. Thank you for watching. I hope this video helped you as a caregiver or stroke survivor with maximizing independence and improving your quality of life in the home setting. Please utilize the comment section below with any questions or comments about the video. Stay tuned for more episodes. Thanks again for your support.